Welcome to day 3 of our Women's History and Wellness Women of HBN Live, right, series. So I'm very excited to have this upcoming guest who's going to be joining us in our series that we're having all month. So I'm Michelle Fletcher. I'm the founder of the Holistic Business Network, which is a community of science-based health and wellness practitioners and businesses. And so a big goal of mine is to help to give more visibility, create more platforms for these businesses to be seen and heard, because in all honesty, a lot of them are the best kept secret. They're doing amazing work and just not enough people know about them. And so this month we're going live with the incredible women, most of them, of the network. And so today we have Dr. Sandra of Florida Internal Medicine. Except, I'm always like fingers crossed every time. Coach Sandra, thank you for coming back on. Coach Sandra was on earlier, and I was like, oh, I have Dr. Sandra coming on. So I'm glad you could get back on. Thank you, Dr. Sandra, for joining us.
So happy to be here.
So happy to have you, because we're going to have a really good conversation. So you are our third guest of the month.
Okay.
So I love this conversation, especially because you're in traditional medicine, but you're also incorporating functional medicine in what you do. So can you give us a quick overview of what you do, and then we're going to go into some more depth there.
Absolutely. So I'm Dr. Sandra Saint-Eloi. I'm a nurse practitioner. I've been in practice for the past 20 years. God, I'm dating myself. And to sum up what I do, I basically design precision longevity strategies for high performing men and women who refuse to age passively. So, and that's how I incorporate traditional medicine and functional medicine, because we're all going to age, but how we age is the difference. So I focus on, yes, I do primary care, but I focus on preventive medicine first and foremost. My niche is perimenopause and menopause care, which has been very neglected, and also hormone optimization for both men and women. So that's what I'm passionate about, because just by optimizing your hormones, you can eliminate so many chronic illnesses that do happen as we age. And based on that, I've created some metabolic reset programs in order to prevent those diseases like cardiovascular disease, Alzheimer's, dementia, basically the decline that happened with aging. And aging is inevitable, but how we age makes all the difference.
Agreed. And, what I wish for everyone is for us to age gracefully with a lot of vitality, to where we're living like we're in the green zones. And a lot of these people that live in the green zones, they pass away in their sleep peacefully, right? We don't want to have 10 years of where we were battling an illness and then that's the end. That's not the best way. So I love that you're incorporated this functional medicine aspect to what you've been doing for all these years. And I will say, I'm seeing more and more doctors make that transition, which is great. Like, I think it's amazing that they're taking on this idea of more natural ways for us to improve our bodies. So, Dr. Sandra, before we get into all the things, I would love for you to share your story, why, taking control of our hormonal health is a big thing for you because of kind of your own experience. I think this will, I love for people to hear this. You know why? Because a lot of times people feel like, oh, a doctor, they just got all the book knowledge.
Mhm.
But they forget that you're real people and that you have your own experiences that might lead you in a certain direction. So,
Absolutely. So my philosophy is if you're gonna talk the talk, walk the walk.
mm,
So everything that I tell my patients to put in practice, I've done myself. And to answer your question, I went through my own journey as far as not being optimal as far as my hormones were concerned. Like I had a hysterectomy. I was in my 30s. I was, I believe, 35 years old. And back then, I mean, until now, surgeons do not tell you what having a hysterectomy will hasten. They don't tell you that by having a hysterectomy, you are going to go through premature menopause. You're not told what exactly to expect. It's basically, yes, you have the surgery. Okay, you recovered. Okay, fine. Like I had no idea as far as hormone optimization. I didn't know any about it. And in going through it myself, like I remember specifically, I was away. It was about 45 degrees. I'm sitting on a patio in a 45-degree weather in a tank top, and I'm fanning myself because my hot flashes was so horrendous.
oh my
Okay.
gosh.
And the fatigue that came along with it, the lack of sleep, the muscle ache, the brain fog. And I thought it was normal. I'm busy. And just like women like us who are really high performing women, we take care of a family, we have a career, we take care of a household, we're managing a business. So for us, we normalize feeling crappy, like I say it in non-scientific words, where we think, okay, the fact that I'm not sleeping well, maybe is because I'm stressed. I'm tired it's because I'm doing so much. I'm not getting enough sleep, but not really understanding that physiologically there's a process that is going within our body that can be corrected. And once I started on this journey, because not only my personal experience, but also taking care of women who came with similar complaints. I'm tired, I'm bloated, I feel inflamed, I'm not losing weight, I cannot think. And, I mean, traditional medicine, I just run the regular labs and tell you, your labs are fine, you're going to be fine, your cholesterol is good, I'll see you in 3 months. But yet, those same women will leave my office defeated because I really didn't address the reason they were coming to see me, nor was I equipped to address their issues. And that sent me on a quest for more information, finding out, okay, there has to be a way I can help my patients get to the optimal part of living than what I am offering now. So it started this journey into functional medicine, which opened up the world of hormone replacement, menopause, and perimenopause care. And that was an eye opener. And I myself, I started with hormone replacement therapy and no more hot flashes. Hallelujah. I have energy like you will not believe. I can think clearer. It's like I have a new lease of life. Just the way
Mm,
that I've been saying is mid-age and midlife is not basically everything is just gonna go down from here. It's an opportunity for us to recalibrate and upgrade ourselves into the second half of our life. Just because,
yeah.
listen, I am 53 years old and I feel like I'm 20. And even today, I met one of my old drug reps who's like, oh my God, you're getting younger. It's all about the way you're living. You're eating
Mhm.
properly, you're exercising. Exercise is absolutely necessary as you hit your 40s. Once you hit that mark, you should be there and picking up those weight and not be afraid of it because muscle is
Yeah.
currency, you know.
Mhm.
So
Mhm.
it's an opportunity for us to shift that mindset where we're thinking, Oh, okay, I'm fully. Oh my God, it's the end of it. No, darling. It is time to recreate yourself, revamp yourself, and take control of your life.
Oh my gosh, so good. So, so good. And yeah, in this next season of life, this is the time for us to pour into ourselves. Like, hopefully by now the
Absolutely.
kids are grown and
Hmm.
older and you can do more for yourself. So I love that you see that. And then you helping your patients see that too. Like,
Absolutely.
yeah. So, because as women, we just tend to want to pour into everyone else's cup but our own.
Except
So,
ourselves. Hmm.
yeah. So what I love that you have done is that you've taken your practice and it is like this haven is you can come in and get consultation with Dr. Sandra for anything that's happening, but she has so many options for you. Like, you have all these functional medicine technologies that I got to experience just the other day.
Yeah.
It just blows my mind. And it blows my mind because I am someone with a background in technology. My whole past is in IT, and to see how far it's come is
Hmm.
amazing. Like, I love that my passion for wellness is now blended with my past of technology. Like, the two worlds have collided, and it is amazing what is out there to help you get your health back. So, can you please tell us and tell the people what you have in your practice that you incorporate in providing other additional services for people to heal?
Sure. So again, it goes with aging with vitality. So I incorporated non-invasive modalities within my practice that not only help you look better, but also feel better. For example, we have the M-Sculpt Neo that builds your muscles by 25% and melt fat at the same time. Not only it has an aesthetic aspect of it, but also it has a functional aspect of it in terms of muscle restoration, injury recovery, and it's the beauty of it is non-invasive. Now, instead of
Mhm.
having to go get a BBL, maybe you get the M-Sculpt, and you're gonna get that clump derrière, but also functionally you're going to be stronger at the same token. We also have MCLA, which is pelvic floor therapy for incontinence care in men and women, like men who've had prostate cancer, who have issues with incontinence, erectile dysfunction. This is the perfect modalities for them. Not only does it help with um, incontinence care, but also sexual wellness in men and women. Because as we hit 30, our muscle mass decreases. Unless we put in place modalities to prevent our muscle function, it is going to continue to go down. Sarcopenia is one of the biggest issues where the elderly patients fall. They lose their balance. And by preserving your muscle mass, not only it helps you metabolically, because muscle help you burn fat, it
Mhm.
helps you maintain your weight. It helps regulate insulin resistance, but also it helps with your balance, your strength, so that you maintain that vitality as you get older. Same thing. Of the pelvic floor is a muscle that we don't realize. And I truly believe any woman who's had a child needs to have some pelvic floor therapy because our
Mm.
kids are great, but what they do to her body as they are entering this world, anybody who has a child understands. And we tend to normalize not feeling well and normalize what is really not normal. Like you coughing, you sneezing, you leaking. Yes, you're wearing a pad, but what will it be worth for you to have that confidence where you don't have to wear a pad? Where you can jump, run after your kids, and you don't have to worry that you're leaking urine, or you
Yeah.
don't have to look for the nearest bathroom, or you feel confined to your home because the minute you go out, oh my God, I have to make sure that I have a bathroom next to me because you have to urinate right away. What about if you
Dr.
get that
Sandra,
confidence back?
I want you to share the testimony that was shared at your event. the other day, and I won't say who shared it because I'm not sure,
Mhm,
but that was powerful. Like, I'm not sure the age, but
mhm.
when she was like, you have to try the pelvic floor, I forgot what machine that
The
is called.
MCLR. The MCLR.
Stella. And
Mhm.
this is just a machine you sit on, guys. And it's the same as doing how many Kegels again?
12,000 Kegels in 30 minutes. And it's not invasive.
And
And
how she was able to avoid
surgery. So
surgery. Mhm.
I am treating a couple of patients who've had bladder prolapse, a couple of women with bladder prolapse, and they did not want the surgery because it can, again, it's invasive, it can be a painful recovery and long recovery. Just by using the MCLA, not only were they able to regain their continence, but also they were able to avoid surgery. And it's a chair,
Amazing.
like you said, you just sit on it fully clothed. There's nothing that goes in internally. And then you just, with high frequency electromagnetic energy, it causes the pelvic floor contraction that we normally cannot do. Like, there's no person who actually knows how to do a Kegel exercise properly.
Mm.
And with this technology, it targets muscle fibers that we cannot even reach on our own.
I got to try that machine and it was like, wow. And you're just
Mhm.
sitting there and it's
Yep.
doing strengthening muscles inside your body that you cannot. It's amazing. Amazing. So to hear that testimony, I think everyone was floored. Like we were in a, and it was voluntary. She was just that happy with her results that she didn't have to now have surgery. That I was just like, wow, that speaks volumes. And I love that an internal medicine doctor has incorporated this type of technology in their space, in their practice, because, you know, you wouldn't have been able to help her other than giving advice and offering the surgeon if it wasn't for that machine.
Absolutely.
Oh my
Absolutely.
God. So
Yeah.
good. So, oh my goodness, what was I going to ask you next? I know that you have, I'm pretty sure you probably use all the machines because you've had your own journey. Not only did you have the experience after you had a hysterectomy, but you've also had like the weight loss experience. And last year, every time I would see Dr. Sandra, she was looking better and better. I was like, well, what is going on right now? Jesus, last year was your year of
Hmm.
transformation. Can you tell us
Correct.
more about that? Because I love seeing doctors that are taking care of themselves because I have a family full of RNs. And
Hmm.
then I also know so many doctors, but I find that there's some doctors that they don't take time for themselves. They're so busy caring for everyone else. And then when they're exhausted, they go home and that's it. And so they let themselves go. But you are not only helping so many people, but you really are focused on getting your health back.
Absolutely. And self care is extremely important, which we tend to neglect. Like with my personal journey, the way I approach weight loss is not just a number on the scale, but it's a metabolic reset.
Mm.
Meaning, not only, yes, you will lose the weight, I give you the tools that are necessary to help you to reach your goal. But at the same token, let's also fix what's going on metabolically, such as your insulin resistance, high cholesterol, high blood pressure, and get you to that path where you are feeling so much better. You decrease your inflammation. Like, I lost 55 pounds myself going through my own program. And what I enjoy doing is taking patients off medication. That is the biggest joy that I have. And when we think about it, medications are not meant to remain in your profile permanently. It is a temporary fix, and medications are absolutely necessary when they are necessary. But the end goal should not have to be for you to be on a medication for the rest of your life. the end goal should be, let's go ahead and put you on medication A to fix problem A. At the same token, let's identify how we can fix problem A from the root cause so you don't have to depend on the medication for the rest of your life. Because and my career started in geriatric medicine, where I was in the nursing homes and seeing patients on 14, 15, 16 medications because you're on medication A to fix problem A. And then you have to be on medication B to fix side effect caused by medication A. And it becomes such an issue with polypharmacy in our elderly patients because with traditional medicine is more symptom driven versus root cause medicine.
Oh
And
my
it's like putting
God.
a band-aid on a broken bone. And that's not the way healthcare should be.
So I love that you have all the experience that you have, because it's brought you to where you are today. And knowing that, listen, you're wanting to get to like root causes, help people actually heal, and not put band-aids over the issue with a number of medications. That's why I really love what you're doing, Dr. Sandra, because it's so good. So if anyone who's on here watching, if you have any questions for Dr. Sandra, because not only is she internal medicine, but she also is functional medicine. And one thing I really love about you, Dr. Sandra, is you are continuously learning. I saw you at a
Yes.
conference this weekend. Dr. Sandra doesn't stop learning, guys. Like, she is like making sure she's up to date in what is happening out there in medicine so she can bring the best to you. I love that, because that's something that all of us should take to heart, that we can never
Yeah.
stop learning. It's
And it's
always.
all and it's all about evidence-based medicine. It's not something that is opinion based. Oh, I think this is gonna work for you. Let's do it. No. I need to understand the evidence behind it before I can institute it. If I don't have the data that shows me that A plus B is working, I'm not going to do A plus B, because
Mm-hmm.
your health is extremely important to me. And everybody should be equipped with the basic knowledge to really be in charge of their health and be able to not only, but also understand what is driving their health care.
Yeah.
What I say is not, again, it's not because, okay, oh, I think this medication will work for you. But your question should be, why do you think this medication is going to work for me? It's not because I'm the provider that here's a prescription, go ahead and fill it. No, it's okay for you to question me and ask me, why am I supposed to take this? You have to understand why certain things are in play in order for your
Mm.
health, because everybody should be the driver of their health care.
Oh, I love that.
Yeah. And us providers, we are a partner. I am a partner with you. It's like I do my part, but you also have to do your part. In order for you to be at the optimal level of health, we have to work together. I cannot do it alone, nor can you do it alone. It's all
Mm-hmm.
about partnership.
And I think that's something that over the years, and there's a generation, like I know, like my parents' generation, that they just blindly follow, whatever that advice they're getting from the doctor. But we're in an age now where hopefully you feel that you can question or ask, why are they prescribing certain things or suggesting certain things, so that you understand too, because it's your body. It's you.
Absolutely.
Yeah. So
Absolutely.
I love that you have that, that you keep that open dialogue so people can understand what is happening and what the goal is to help them. That's so good.
Yeah, and the
So
better
good.
you understand it, the more you are apt to adhere to any particular regimen. So if I just give you something blindly and you're like, okay, yeah, she told me to take this pill, okay, I'm just going to take it. But if you don't understand why I tell you to take the pill, what's your motivation to continue taking it?
Mm-hmm. Exactly.
Yeah.
Yes. Yes. So, okay, what advice do you have out there for, because I think I'm going to be 50 this year. I'm definitely your target audience. But one thing you taught me is that we're seeing that perimenopause is happening earlier and earlier
Mhm.
for the generations to come is like people are in their early 30s now having symptoms of perimenopause. There's a lot of reasons for that we can go into that rabbit hole. But what do you advise for those people? Do you think that you are someone that should be a resource in that situation? I think so. You've already experienced it from a young age yourself. But what do you say to that?
So, yes, I am definitely a resource, and finding providers like myself who are open to the latest evidence, because there's a lot of misinformation out there as well, and
Mm-hmm.
outdated information. So, if you don't come to me, which I hope you do, but if you do not, make sure that you go to a provider who is up to date on the latest advances of hormone and hormone optimization, not necessarily replacement, but hormone optimization. And as far as perimenopause, the average age of a woman to go through menopause is between 45 and 55. Now, think about it. We start having symptoms 10 to 15 years prior to that. So it's not unusual for a woman who was in her late mid 30s to start having perimenopausal symptoms. And
Mm-hmm.
we are, as it is happening, we are not sure what is happening with our body. We just know something is changing. So I can see a woman who's 35 who started having perimenopausal symptoms, you know, and there are ways that we cannot necessarily avoid it because that is inevitable, that is part of normal physiology. But there are things that we can put into place in order to diminish the effects, sort of speak, or the symptoms of perimenopause. First and foremost, diet. I
Mm-hmm.
am a firm believer of you are what you eat. Particularly now, the way our diet is ultra processed, all the added sugars, all the additives. There's a lot of artificial stuff that goes into our food. We have to be conscious of it. What we eat matters. And it's eating the cleanest form of food. It doesn't have to be like a diet. You can still have amazing food, but still eat clean.
Yeah.
Number two, sleep. Sleep is extremely important. This is how our body regenerates, is by sleeping. And most of us do not get the average 7, 8 hours that is necessary for our body to restore itself. We either on our phone, technology before we
Mm-hmm.
go to sleep, which further impairs us and prevents us from sleeping. And number three, stress management, which nowadays is really hard to manage because we get hit at left and right with so many stressors in our environment. And knowing how to mitigate that stress is challenging, particularly now with what we're going through with our current events. And it's just trying to find that fine balance. It's like what I say is find that 15 minutes, 30 minutes in your day that is just for you.
Yep.
Regardless of what's going on, just block that time. If you have to put yourself in a closet and listen to some meditation
Yes.
music or whatever, just for like 15 minutes, just so that you can reset, find that time for you. We are like hamsters on a wheel, always going, 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 going. We need to take that time and stop and really care for ourselves, and especially women. Like you said before, we take care of everybody else and then put ourselves on the back burner. But how about we reverse that a little bit? Let's take care of us first so that we have the strength and energy to take care of others and be able to pour into others. Because if you
Mm-hmm.
are an empty vessel, how can you take care of somebody else properly?
Exactly. Exactly. And I think this conversation is so funny. I spoke about this exact topic at two different conferences I was a part of recently
Mhm.
because I'm just like, if you don't take that time for yourself, and it was a common theme. It was like, I'm glad to hear the conversation become normalized,
Mhm.
to not be running yourself into the ground for everyone else. And then when something happens to you, now you're looking like, oh my goodness. So I
Mhm.
love this conversation. I love that it's coming from an internal medicine doctor slash functional medicine doctor. Well, it makes sense that it's coming from someone like you because you've got the best of both worlds going on here. So as we close out, what are any final words of it? Actually, as we close out, please tell people how they can find you.
So you can either call us at 954-725-7291, or just send us an email. You can email us at info@fimadocs.com, FIMADOCS.com, or follow us on Instagram at Fimadocs. It's FIMADOCS. You can always send us a DM. Myself or my team will be more than happy to answer the questions that you have. Just give us a call and set up your consultation. What I say is apply for your reset and self-care.
Yes. And you will be tagged or collaborated on this replay. So if you're watching a replay, say replay, but Dr. Sandra's practice will be tagged on here. So you can easily just go up and click on that link and it will direct you to her page too. This was such a great conversation. I'm so glad you could take the time out. I know it's like lunchtime. You probably just got a quick break, but I'm so glad we could have this conversation and you could be featured in one of our amazing women in wellness for the Holistic Business Network. We are so honored to have you as a part.
Thank you so much. It is such a joy to be part of this community.
Thank you, Dr. Sandra. Wishing you an amazing day. Keep helping all these women and men. Dr. Sandra also has men that she helps too. So don't feel like you're excluded. Keep helping all the people because we need you.
Thank you. Thank you.
Thank you.
All right. Bye, Michelle. All right. Bye-bye.